In the first part of the Healthcare Convention, you saw the first 4 sessions of the event. Here's the remaining discussions of the event, which continued the topics of technology, innovations, and their solutions.
And I'll start with Ajay himself. So he can start describing about whatever he thinks about these things. We can evolve from there.
Thank you, Doctor. Since we are doing hospitals today in 9 countries as I sit here, and the technology can be used anywhere, any country is possible, which is applicable in US, I can apply in India, no doubt, no problem. So that's where we play a role. It's very, very critical that when we design a hospital, all the stakeholders, including the owners, operators, architects, engineers, have the same vision, have the same plan, and stick to the plan, which means virtually agreeing on the hospital, not as built, virtually agreeing. Once you virtually agree to the hospital, then I can build an intelligent hospital. Then I can compartmentalize the hospital into components and make it in factory and assemble it like an automobile industry. But if you don't virtually agree pre-hand that what the hospital would want to be, what the vision of the whole stakeholders is, then it's typical construction. I'm going to pour concrete, labor is going to go on the top, do this, do that. It's going to become all that. Then you load the digital aspect to it. But the building will be still as basic as possible.
My take of the way we are seeing in the future trends and all is, I think the first part is there is a lot of sophistication which has started coming in. If you look at from the kind of air quality designs which are being asked in the hospitals to the air pressure requirements, because that itself has a lot of role to play in the infection control, down to the kind of electrical systems that are being provided. The fire safety is a big issue, because how do you evacuate in case of fire, in case of emergency, what happens? We keep on, I'm sure some of you who are involved in the hospitals would know, there are challenges about building tall hospitals today. Our national building code doesn't even go beyond 30-meter height in hospital designs, whereas as the land is becoming more and more dearer, the FSIs are going up. The hospitals are sitting with the unutilized FSI because they cannot go beyond 30 meters.
If you see from the healthcare architecture perspective,
Exactly.
you have to map out what you are looking for, make your wish list first, work on paper as much as you can, because changing a line on paper is pretty easy. But once you had built a hospital and then you realize, okay, fine, this is not something which we are looking for, then the disaster happens.
Tarun said very clearly we have to spend a lot of time on paper. So he said there are 4 wish lists everywhere. So I also believe we should keep all those 4 wish lists in mind. But those 4 wish lists, according to me, are the 4 P's of the medical fraternity that we have. We have to keep in mind the needs of the patients, the physicians, the payers, as well as the provider, that is us. So if we keep the needs of all these 4 in mind, only then can an effective hospital be built.
In this session of the Healthcare Convention, all the panelists discussed the future and development of healthcare industry.
I have a very knowledgeable panel of experts with me to talk about technology and innovation in the area of healthcare.
Doctors are hesitant to use technology. Now there is a very important reason why are they hesitant. Well, as engineers, as lawyers, as any other profession, we do take risks, but we don't risk lives. Doctors risk lives. So we cannot expect them to actually give time to anything else than their profession. So we made a very simple product so that they understand essentially how to use a mobile app or use a web portal. Forget about typing, forget about everything. Just make them understand that there is a mobile app or there is a web which you can open and you can do something which you are already doing. That was the basis of why we made that.
There is a huge gap in terms of technology and innovation. All the technology, all the innovations we are using, these are only concentrated in metro cities. Although we at Cygnus we are trying to implement best of the technology in our hospitals.
As far as the medical field or healthcare is concerned, it has always been driven by technology. Always. Whatever we see today as the modern hospitals are very different from whatever when we were trained, especially if I can talk about myself, at the time I was trained, it is now entirely different than what technology is available today. And technology, of course, plays the most important role in whatever we are doing in healthcare as well as today's discussion. Thank you very much.
The summit hosted over 250 industry experts from healthcare industry, medical tourism, IT, innovation experts, medical experts, hospitals, infrastructure companies, all under one roof to discuss the way forward for the growth of the healthcare industry.
There is a lot of insulation issues in terms of roofs, in walls, windows, etc., which gives a lot of solar energy coming into the rooms and which leads to a lot of discomfort to the patients. There's a lot of sound pollution, which at times not only have a lot of discomfort to the patients, but also leads to nursing errors. So yes, of course, a well-designed hospital building can actually accelerate the curing process of the patients.
We doctors and organization are paid to keep people unwell. Let's say I'm a gastroenterologist and you have colitis. More you come to me, more I can do an endoscopy, I make more money. And India and US is very similar in this. And so we create a lot of tests, we create a lot of consultation, a lot of surgeries. Whereas if you look at the European system, the GPs are paid to do the opposite. Moment you refer to a specialist, your money goes down. So you are paid to keep people well.
What I will be doing in this presentation will be just to briefly update you, make you aware about these issues, and see as to how we can have a collaborative framework so that we can possibly join these issues. Because sometimes, unknowingly in the past, you may have been asking for certain requirements from the government, and this has been creating a problem for the long term for you yourself.
This was followed by discussions on IT infrastructure and regulatory policies.
So the way I think we will proceed with this session is that I'll first invite Mr. Sharad to speak, given the context of this session, about healthcare IT. This audience should know, and so I think we could start with you. So
Why exactly a hospital needs a software? These all are some basic things which we need to understand. Basically, what are these softwares? These are a set of processes. How exactly from patient coming to a OPD reception to going to a lab, then a radiology department, buying some medicines, then going to getting admitted to the hospital, all the services. What exactly a hospital software does briefly is takes care of all the processes, steps involved in patient care.
There was a question-answer round where visitors showed their great enthusiasm.
My question is on coordinated care of patients. When you have a chain of hospitals, you can have multiple centers catering to a single patient. Let's say a telemedicine between doctors and not the patient directly connecting with the super specialist. So how do you see that coming in, and is that even a part of your plans?
Actually, we have already started this as a pilot project right now. We have started this from our Kurukshetra center, and also 1 or 2 patients we have done in Karnal center. Similarly, we are trying to do this, that the moment another physician comes who is checking everything, who can palpate him, who can talk about him, who can see his fundus and tell the findings to the super specialist, what is the problem in his compliances. So that gives, and the patient is sitting there, the interaction is going on Skype. So I think it is a huge benefit, which there are few companies who are working on this, and I see a huge future for this kind of application in future.
In this session of the Healthcare Convention, all the panelists discussed the future and development of the healthcare industry.
So we have a very good panel here, and I'll start off by asking Dr. Naveen Nishchal. He is the Director of Operations So in tier 2, tier 3 towns. So Dr. Naveen, what are the difficulties and challenges that you're facing in operational issues in delivering healthcare in tier 2, tier 3?
There are few challenges which we need to find answers together. So the first challenge I feel is doctors. So it's very difficult to attract a doctor in these tier 2 cities and able to hire them on minimum guarantee with hefty salaries. Then it becomes really difficult to retain them.
I fully agree with Dr. Saab's opinion that manpower is a big challenge. It is all across the spectrum. To do with the consultants, with the resident doctors, we have to compromise with the eyes doctors. Nurses are not available. We train them and then call them nurses, or we hire ANMs who are untrained. So we had a solution for that. See, we started a nursing school. Initially, we had GNM over there, then we added ANM over there, and now we are running paramedical courses in our own institution to handle that challenge of manpower.
Today we have neurosurgeon in each district of our facility, and we have intensivist in each hospital. We have radiologist in each hospital. Of course, there is no problem of having a general surgeon or orthopedic surgeon. But at the same time, the challenge you would face in future has to be anticipated at a planning stage. While you decide what kind of facilities you want to start, what kinds of specialty mix you want to start, you have to be very clear where to invest. If you are trying to replicate a secondary care in a district town, probably you'll never be able to compete with the local secondary care provider who already exists in the form of couple-run nursing homes.
And I think that what is clearly seen by us is that what works in the metros does not necessarily work in smaller towns. And I think you have to go with a differentiated model, and you have to do what it takes to provide healthcare in those towns. I think that's the kind of key which works.
Wherein it is very important for everybody of us to spread awareness in the tier 2, tier 3 sectors. And that's one of the most important reasons why insurance is not able to penetrate in these tier 2, tier 3 towns. I firmly believe that government also comes into picture, wherein they have to kind of bring to the people sort of education, sort of awareness. I believe firmly that there's a need for private and public partnerships come into picture. So having said that, I think it's very important for us to spread awareness amongst the people, and the people is the basic factor and element, very, very important for us.
Many delegates from India gave their view.
I think this conference, which we've just attended and had a panel discussion on, has very relevant topics, especially because we truly believe that the tier 2, tier 3 opportunity is in healthcare is something which to be tapped if you really want to provide healthcare access in the country.
We attended this 2-day healthcare convention, so it gave us really good insights about what is happening in the healthcare industry. We have been here along with my batchmates to attend the 2-day healthcare convention at Hayat Delhi, and it's been a great experience and we've learned a lot of new things.
I, along with my batchmates, attended this healthcare convention, and it gave us a vast experience, a good experience, and insights from all around the country.
I attended this healthcare convention 2015 in Delhi. It was an enriching experience from eminent panelists all over the country. It was indeed a very good experience. I had some of the great insights and great experience shared by a lot of famous personalities from all over the country.
We are here for the convention center seminar, and it is very informative for us.
The healthcare convention was a great initiative for future of the healthcare industry. Many problems with their solutions were discussed by experts from various fields, and this initiative will open up new avenues to benefit the health sector.